I feel like depression is kind of like IBS, where it's like, okay, you've got a cluster of symptoms, but your root cause could be as varied as like anemia, hypothyroidism, celiac disease, postpartum, insomnia, even dehydration.
I've had so many people who just straight up are not drinking water. It's insane. And they literally are not thinking clearly. I'm like, you're not depressed. You're not. I got you.
So depression, it's like that singular symptom that's your check engine light. But in terms of the root causes that we're looking for, the things that we'll bring in that are specific to depression, it depends what type of depression. If it's irritable depression, low serotonin depression, we are bringing in that serotonin support immediately. We're going to really focus on a very like optimally glycemic index diet. So proteins and carbs paired together so that you can actually transport serotonin across your blood-brain barrier, for example, tryptophan. And so you can make serotonin within your brain. If it's like anhedonic depression, which is more dopamine, and you're just like, I don't care about anything anymore. I used to be driven and now I can't even get out of bed. Like, and nothing brings me joy. Okay, we're bringing in the dopamine support for sure. If it's depression that's really linked with a trauma or PTSD and that has flattened you, then we're bringing in the GABA support. We're bringing in EMDR, trauma specific focus therapy. There are certain herbs that can be really powerful. Acupuncture is like an amazing therapy for depression. And even homeopathy has been shown to have similar effectiveness to fluoxetine in treating depression. And so for me, it's all about the data, right? Whatever works, we're going to use it. And we tend to kind of use it all at once if we can, because we want people to get better really fast. And the one thing I'll say is if you're on an SSRI or a medication and it's working for you, great. We are never the people who are going to say, go off your medication at all. Our job is get everything else working, reduce side effects of your medication if possible, make it work better at an even lower dose, save you some money if possible, and get you to this place where you just feel like you're thriving. And oftentimes what will naturally happen is people can kind of gradually go off their med. But that truly integrative approach demands that we work together.
Our goal isn't necessarily for you to not be on medication, but our goal at the end of the day is to be able to let you function and to thrive on your own. I think sometimes people are so dependent on needing these other things, whether it is an SSRI or other things, that they feel like they can't and are not capable of doing things anymore without it. And so there's a fear of not being on these things or what's going to happen if I'm not. And when you can take a more natural approach, like you're never going to stop eating or stop drinking. Those are things that we just want to integrate into your life on a general basis. The difference is we're not necessarily trying to take you off medication. If it's working, but can you do something with that? Like, what are you doing to contribute to that? And again, to empower them to be able to feel able.
With anxiety, we definitely tend to see a lot more allergy, histamine, nutrient deficiencies that play a role in that anxiety. With depression, what I will say is a lot of times we see chronic inflammation and just that neuroinflammation.
That's another huge one.
Right. With depression in particular, because of the inflammatory component of chronic pain, but also sort of that like neurological conditioning that you get. And the third thing I would say is that social isolation plays a huge role. And so one of the things that is so powerful about Sonare is that we do group therapy. And people are scared of that. I think sometimes at first they're like, I don't want to talk to anyone else. I can't tell you how many times my sessions are like interrupted with laughter. So I'm sitting talking one-on-one with a client, and the room next door, we have like a group of 12 teenagers and they are belly laughing. And it is so sweet and such a good sign of health. And you don't get that in your room. You don't get it. Like you might get it one-on-one with your therapist, unless your therapist is doing stand up. There's something about being with a group of your peers and knowing like, first of all, I'm not alone, but second of all, feeling that joy again is a huge part of treating depression.
Just like a weight off your shoulders of like, I don't have to hide this, which is half the pressure that goes into depression, anxiety, is trying to make it seem like you're not letting anybody else know. I think that's the biggest thing that keeps it going longer.